Here at University Hospitals Dorset, we have simulation suites within our education centres. At the education centres, we run a number of simulation courses. These include the ITU transfer course, where we look at transferring patients with critical conditions between hospitals. We also run healthcare support worker induction courses, which allows individuals new to healthcare to learn the basic skills. Within cardiology, we have run scenarios regarding placement of a magnet over the pacemaker for certain clinical procedures. This protects the patient by deactivating the pacemaker. We are very fortunate to have simulation suites within our education centres where we can run scenarios covering a multitude of clinical conditions. The control room is where we can set the mannequin's observations such as respiratory rate, blood pressure and pulse to replicate the signs of a real patient condition. This allows learners to train in a safe environment and practice treatment for conditions they will see within the hospital. The simulation suite has cameras fitted which allow us to link to the lecture theatre for larger group learning. After each scenario, we allow time for staff to have a debrief session. This is where we discuss any learning points gained during the scenario. The clinical education team also takes simulation mannequins out to clinical areas to allow in situ scenarios to be run. This is practicing CPR and the use of a defibrillator on a simulated patient that has had a heart attack, and also for practicing the clinical skills needed to care for a patient within the intensive care department. It is especially useful for paediatric training.
Okay, so we're just going to open baby's airway a bit and give baby a little bit more help with some oxygen. So 5 inflation breaths. 1, 2.
Taking simulation mannequins into the clinical area allows staff to practice treatment and gain confidence. In this scenario, a simulated patient was having an operation and lost a lot of blood. Learners practiced the steps involved in giving blood products within a critical time period. This scenario was a simulated patient arriving into the emergency department who had been stabbed. Staff practiced role delegation during the scenario so that each person knew their responsibility during this emergency. Simulation mannequins in practice are an excellent tool to allow learners to gain experience so that when the situation arises in real life, they are both confident and competent. Staff within ITU use mannequins to practice the teamwork required to turn a patient onto their front in the prone position. Proning is used when patients are sedated for long periods of time. Proning also proved to be extremely beneficial as an aspect of care treatment for the patient suffering with COVID. The use of mannequins was instrumental in the training of the anaesthetic team in intubating a COVID patient safely. This involved practicing the correct use of protective equipment and stages completed in this critical procedure.
Okay guys, we'll just do the pre-intubation stop. Yep. Moment, just confirm this is the correct patient. We should have Vivian Westall, yeah. 12-12-48. Yeah. Okay, we're pre-oxygenating at the moment. I've got a good seal, the oxygen is running. Good. Suction's under pillow and is ready to go. Yes. The video laryngoscope is on and ready to go. Yeah. Okay, and we've got our plan A, B, C, and if we need it, plan D, all set up. You happy with that, Ali? Yeah, happy with that. Okay, ventilator. It's ready. Plugged in, ready to go, plugged into the oxygen. Plugged in, ready to go. Okay, the capnography is on and the SATS probe is working and we're now saturating at 96%. Yeah. Are you happy with your IV line, Lindsay? Yeah, it's running nicely, thank you. Okay, and we've got a blood pressure and that's set to cycle when we go. Yeah. Emergency drugs drawn up and ready to go? Yes. And you're ready with all your intubation drugs? Okay, so the airway plan is going to be, guys, we're going to induce and then we'll intubate with the video laryngoscope. Yeah. I'm going to keep this on. If we fail to intubate, we'll bag mask valve and then we'll use the eye gel with the gastric port sealed. Yeah. Okay, ambioscope if required. Dom, you alright out there? Yeah. Okay, if we need you, we'll call you for the emergency front and neck access. Okay. Right, everybody ready? Yeah. Yeah. Okay, let's induce. Yeah, 5 minutes of oxygen given. Right, drugs are going in. Now.
Going off to sleep, Vivian. Got cranium meshes in. We're going to put the timer on.
Okay, so we need 1 minute.
Let you know when 1 minute's up.
She's still holding a set.
Okay.
Okay, that's 1 minute up. Let's get ready to intubate. Lindsay, can you turn the wall oxygen off for me?
Yeah. Wall oxygen is off.
Okay, put that down now. Okay, I've got a view. Okay, I'm in. Cuff up.
Cuff is up.
That's coming out. Yep,
Ventilator
please,
ready?
Yeah, ventilator ready. Okay, cuff is up. Start the ventilator, please. Okay,
ventilation started.
just check our capnograph trace.
Yes, capnograph positive.
Yeah, we've got a capnograph trace, okay.
When the patient is stable, anaesthetist 2 will throw away the unused airway kit, remove her outer gloves, clean down the trolley and pass it out to the runner for a second clean down. Anaesthetist 2 then safely doffs her PPE and takes the trolley and box 3 back to the hub for restocking.
Okay, Ian, are we happy for the transfer checklist?
Yes, we are.
Marvellous. Are all connections secure?
Yes,
Do we have adequate sedation and paralysis?
yes,
Is the ventilator connected to the portable oxygen?
Yeah.
it is, yeah.
Do we have adequate portable oxygen?
Yes,
Do we have necessary emergency drugs?
yes we do.
Do we have the intubating equipment, including the video laryngoscope, the water circuit on the bed?
Yeah.
Have we considered ambu bag if we're going in a lift?
Yeah,
And do we have the patient notes? Yes. Marvellous. Good to go.
we're good to go.
As you can see, the simulation mannequins are extremely beneficial in training staff safely across all of the hospital departments for a multitude of clinical conditions.